All right, in this slideshow, we're following up with the last one. Now we're going to be looking at specific host defense mechanisms. Remember, the non-specific ones, we're looking at just keeping anything that isn't part of you out of your system. So in this one, we're going to be looking at specific defenses. And what we're really looking at here, understanding immunology, the primary functions of the immune system, the arms of it, immunity in general, what cells are involved, and where do these responses happen. And then also, we're going to talk about the difference between humoral immunity and cell-mediated immunity. We'll look a little bit at hypersensitivity reactions and autoimmune diseases and immune suppression, and even a little bit of the immune lab where we test for specific immune proteins. So immunology is the study of the immune system and the immune responses. Mainly, the immune system has a couple of defenses, or a couple of functions. One is to differentiate what is self and what is not self, and to destroy that which is not self. So the cells involved in immune responses are all grown in the bone marrow. Lymphocytes are derived from the bone marrow, lymphoid stem cells. We get B cells and T cells and natural killer cells that all come from this. T cells, we can break. Your book talks about two types, helper T cells and cytotoxic T cells. We actually now know that there is at least one more type called the regulatory T cell, which helps to control the cytotoxic T cells that want to destroy self. There are two major arms of the immune system. One is the humoral immunity, humoral referring to the plasma, and this is where antibodies live. These are proteins that are made by B cells that attach to microbes and help destroy them. Cell-mediated immunity involves a whole bunch of different types of cells. The B cells and the T cells, antibodies are involved, but basically only as a signal to the cells that are playing the roles of destroying the microbes. So here you can see in the humoral side, always involves antibodies. Antibodies basically drive this. In cell-mediated immunity, it could involve T helper cells, cytotoxic T cells, delayed hypersensitivity T cells, natural killer cells, granulocytes, the macrophages and neutrophils will play a role here as well. Antibodies do play a role in attracting these cells, but they don't actually do the destruction themselves. So how do you get immunity? Well, most often you acquire it. And there's a couple of ways that you can acquire immunity, passive or active. Now, active requires your immune system to learn what the infection is and produce antibodies for this. And this typically gives you long-lasting, years and years and years of protection against whatever microorganism we're dealing with. Passive acquired immunity, this is basically antibodies that are given to you either by another person or by another animal. And this is very temporary. So both natural and active immunity, both active and passive immunity can have natural versions and artificial versions. So natural immunity is what happens naturally. Artificial immunity basically means you have to be given it. It's artificially induced. So you could have basically natural active immunity. This is what happens when you get sick. Artificial active immunity is when you don't get sick and get over it, but you're actually introduced to the microbe artificially. So the most common active artificial immunity is a vaccine. Basically, this is a material that will trigger an immune response to an infectious disease, but usually the vaccine does not contain the actual pathogen. It only contains the parts of the pathogen that will start an immune response. So basically, we take a living or dead pathogen, we disable it, and then we create a vaccine from it. So the vaccines stimulate the immune system to produce antibodies. Because the immune system has to learn to recognize the vaccine, and therefore will make antibodies, this is an active process. Now, vaccines available are many, many types. Attenuated vaccines are basically weakened microbes or pathogens. Inactivated vaccines are destroyed or killed. Subunit vaccines are actually just exposing you to the antigen that will cause the reaction. Conjugate vaccines are when you combine multiple vaccines together. And then a more rare type, a toxoid vaccine, is something that will introduce you to the immunogenic part of a toxin, so that if you are exposed to this toxin, your body knows how to deal with it. This is one of the ways people become quote unquote immune to poison. And if you didn't know what it looked like already, here's a picture of a little boy getting a vaccine. He looks so happy, doesn't he? Now, passively acquired immunity. By the way, how do you know a vaccine is active? Most of the time, if you are given a vaccine within the same day or the following day, you will develop a small fever. Not a major one, but a small one. And that small fever is actually evidence that your immune system is working to discover what this is. That is a primary immune response to the vaccine. It doesn't mean the vaccine made you sick. It means the vaccine is triggering your immune system to work, which is what we want it to do. Now, passively acquired immunity is when antibodies are produced in one person and given to another person, or in one animal and given to another person, and they provide temporary protection. The natural version of this happens between mother and baby. IgG antibodies pass through the mother's placenta to the fetus, so when the baby is born, it has a handful of these IgG antibodies that will provide it immunity very early on. Also, IgA antibodies are found in mother's milk, and every time the baby breastfeeds, the baby gets some of these antibodies. Now, artificial passive acquired immunity basically means you are given an antibody that was made somewhere else. So the best example is the anti-tetanus antitoxin, which would be given to you after you are exposed to tetanus. So usually if you step on a rusty nail or do something that potentially exposes dirt to a wound and therefore potentially exposes the body to Clostridium tetani, you will get a tetanus booster for the vaccine, and you will also get an antitoxin, a tetanus antitoxin. It's not the bacteria itself that is the most harmful thing for you. It is the toxin the bacteria releases that causes tetanus. So we want to bind that up with antibodies so it can't actually cause harm. The other really common example of this is something called RhoGAM. If you are an Rh negative mother, and there's a chance that your baby is Rh positive, you will be given a shot called RhoGAM at a couple of different points in pregnancy, the most important of which is right around delivery, so that if you're exposed to the baby's blood, your immune system doesn't try to kill it off. Antigens. These are surface proteins that are found on all cells of all living things. There are thousands and thousands of these on every cell, and these are basically large enough things to stimulate the production of antibodies, to create an immune response. So substances capable of stimulating antibodies are considered to be antigenic or immunogenic. Bacteria has many antigens on its surface that can trigger the production of antibodies, so it's very immunogenic. So proteins, the antibodies that we have been talking about, these are proteins made by the lymphocytes, B lymphocytes in particular, in response to the presence of an antigen. They belong to a group of proteins we will call immunoglobulins, and they trigger and help with immune responses. This is a picture of a typical antibody. It's 4 proteins, 2 light chains and 2 heavy chains. So where the light chain and the heavy chains come together, you have at the very end an antigen binding site. These are the variable regions. And then the rest of this, from here to here, that's where the 2 heavy chains meet. This is the constant region. So this will bind to a pathogen, and this will then signal white blood cells or other things to come by and help destroy the cell. Now, the amount and type of antibodies produced by any stimulation depends on the nature of the antigen, where it was stimulated, how much of it is present, and the number of times you've been exposed. Every time you're exposed to something, your immune response is stronger and quicker. Now, the majority of antigens are referred to as T-dependent antigens because T cells are required to process them. There are only a handful of T-independent antigens that just require B cells. So the T-independent ones, the rarer, a B cell with a specific antigen will bind, or specific antigen receptor will bind to a cell with that antigen. That will then trigger the B cell to multiply or go through cloning. And of those clones, it will make a whole bunch of plasma cells who will make antibodies that are complementary to that antigen and will attach to that antigen. And then we'll make a handful of B memory cells, things that will remember what this looked like. So the next time your body comes into contact with this, you can make a much more efficient response. So the processing of either the T-dependent or independent antigens results in B cells becoming plasma cells, which make antibodies. Now, the first time you're exposed to an antigen, this is your primary response. And usually, antibodies are going to take anywhere from 10 to 14 days to be produced following this response. How many of you have heard the story, I got the flu shot and 3 days later I had the flu? Well, guess what? The flu shot was going to take a couple of weeks, so we're going to have 2 weeks to produce the antibodies to prevent you from getting the flu. This is why we like to give it in the fall, so that when winter, prime flu season comes around, you actually have antibodies around. The increased production of antibodies following that second exposure creates a secondary response, which is usually much quicker and much more lethal to the pathogen. Immune responses happen in the blood and in the tissues. So basically, if you have immune responses in the blood, this is going to happen in the spleen. In the tissues, this is going to happen in lymph nodes or in tonsils. Antibodies, there are 5 classes of antibodies that are going to attach to things, and each of them has a different function in your body. And this is just an interesting one. All antibodies are immunoglobulins, but not all immunoglobulins are antibodies. Now, the 5 classes of antibodies. There is an IgA antibody. This is found in secretions in the body, including in your sweat, in your tears, in your saliva, and probably most notably in breast milk. This is where the benefit of breastfeeding babies comes from. In these antibodies that are going to get into the baby's body, primarily in their digestive tract, but some of it will be absorbed and actually travel through the body. IgA can also you can find it either as a single antibody or you can find it as a dimer where the 2 are attached to each other. IgD antibodies. These are usually attached to a B cell and most likely help to trigger immune responses. IgE antibodies, these are the ones that are going to drive allergic responses. IgG antibodies, these are the ones that pass through the placenta. They are also the ones your body will make once it has developed immunity to something. So this is the antibody that you will see in large numbers in secondary and later infections. And then IgM antibodies are interesting. These are typically found in a pentamer attached to a B cell. Pentamer meaning there are 5 antibodies attached to one cell, which gives you 10 variable regions and allows you to attach to 10 different things and try 10 different ways to attack this bacteria or virus or what have you out. This is the type of antibody that you are going to see in primary immune responses. It is also the one that's responsible for agglutination reactions. Monoclonal antibodies. These are, so there are antibody producing cells called hybridomas. They combine a single plasma cell in a rapidly dividing tumor cell. And they will produce a specific type of antibody called monoclonal antibodies. These are used in diagnostic procedures. Basically, monoclonal antibodies are being evaluated for the use in fighting diseases, killing tumors, all sorts of stuff like this. But what we see in this is as people age, late middle age and older, monoclonal antibody levels seem to go up. And for most people, that's not a big deal. But when those monoclonal antibodies reach a certain level, it leads to the diagnosis of a disease called multiple myeloma, a bone marrow tumor. Now, when an antibody attaches to an antigen, you now have an antigen-antibody complex. The antigen-antibody complexes actually will activate complement cascade, and then that can activate leukocytes, that can help destroy bacterial cells, that can increase phagocytosis by opsonization. So cell-mediated immunity, the antibodies can't enter the cells, but in cell-mediated immunity, basically you have this interaction with a whole bunch of cells and secretions of these cells. So the immune system will actually control chronic infections by intracellular pathogens like bacteria, viruses, fungi, and even tumor cells. So it's the cells that are participating in here in the cell-mediated immunity, macrophages, T helper cells, T cytotoxic cells, natural killer cells, and those granulocytes, the neutrophils, eosinophils, basophils. Natural killer cells are a type of lymphocytes. They're granular. They resemble lymphocytes, but don't have this B or T cell surface markers, and they don't proliferate in response to an antigen. They appear not to be involved in antigen-specific recognition. They just look for stuff that isn't right, and they kill it. And in fact, these are the cells of your body that are looking for tumor cells and getting rid of them, so that even though all of us have precancerous cells growing in our body at all times, most of us aren't going to develop cancer. Hypersensitivity reactions, basically, hypersensitivity is an immune system that's overreacting to a non-harmful pathogen. Well, not even a pathogen, a non-harmful antigen. And there are different types of hypersensitivity. Immediate type occurs either right away or within the first day after contact. We can say 1, 2, and 3, types 1, 2, and 3 are immediate or near immediate type. Delayed hypersensitivity, delayed type, takes over a day for it to manifest itself. And that's sometimes referred to as type 4. So type 1 is the anaphylactic reaction. Basically what happens is the introduction of this antigen will trigger the IgE antibodies to elevate, and will trigger the they will bind to basophils or mast cells, cause a release of histamine system-wide. And what this does is a couple of things. It causes dilation of the blood vessels in the mucous membranes, which causes them to swell. And the swelling of those mucous membranes will then actually close off the airway and create symptoms like asthma and hives and stuff like that. But at the same time, will cause your blood vessels to dilate drastically throughout your body, causing a significant drop in blood pressure, which means it's harder to get blood flow to the brain. And this is where anaphylactic shock happens, when you combine the closed off airways with the damage, or with the dilated blood vessels and the lack of blood flow to the brain. And this could be a result of food allergies, bee stings, drug allergies, all sorts of stuff. The type 1 immediate response is probably the most common type. If you are prone to allergies, you make these IgE antibodies, and then the allergic reaction results from these antibodies being bound to mast cells or basophils, and that drives the chemical reactions we talked about. Now in type 1, the first time you're exposed to something, you actually have to sensitize the mast cells. So the first exposure usually isn't as bad as following ones. You're binding to the allergen, and it will release some histamine from the mast cells. And this is what it looks like in real life. Now, type 1 reactions can be localized. If they're localized, they usually just result in a rash, maybe hay fever or asthma or something like that. But it's one area. Systemic reactions can happen, and they typically are the version that we worry about, the anaphylactic shock, which can be life-threatening. Like I said, systemic anaphylaxis results from the release of chemicals in from basophils and causes a body-wide reaction. Insect venom, drugs, for some people, shellfish or peanuts will do this. Latex can trigger any of those reactions, either contact dermatitis, allergic contact dermatitis, or even anaphylaxis. Now, how do you know if you have an allergy to something other than, going to the hospital with anaphylactic shock? Well, if you know what your allergens are, you can actually avoid them or carry an EpiPen in case you do come into contact with them. Usually we do either scratch tests where you scratch the surface with the allergen, or you do a subcutaneous injection. And either way, what that will cause is a cutaneous reaction, a swelling at the site that can actually be measured to grade how severe the allergy is. Now, in order to treat this, medically, we typically use immunotherapy, allergy shots, which basically means we're going to take this allergen and inject a small amount of it into your muscles, IM injections. And what this will do, typically, if we're introducing the allergen to a different part of the body and allowing the body to recognize this isn't dangerous, hopefully then it won't cause a problem when it's introduced to the place that typically was causing an allergic reaction. Now, we can also inject a person with IgG blocking antibodies, or, well, they're produced in response to the allergy shots. Potentially, this has a good result. The type 2 hypersensitivity reactions are cytotoxic reactions. The body cells are destroyed during these reactions. And usually what happens is, say, a drug or a chemical binds to the surface of the cell, and then antibodies bind to the drug or the chemical. Complement activation on the surface of the cell is initiated and causes lysis of that cell. Type 3 hypersensitivity reactions, these are the immune complex reactions that lead to serum sickness and sometimes even with autoimmune disorders. We see type 3 hypersensitivity reactions in rheumatoid arthritis and lupus. And they involve the IgG and the IgM antibodies that also involve neutrophils and complement. Some complications of inadequately treated strep throat, specifically with strep pyogens, could lead to type 3 hypersensitivity reactions, and that's where rheumatic fever, glomerulonephritis, scarlet fever, all of that comes from. Type 4 hypersensitivity reactions are the delayed type. Basically, you come into contact with something and 1 or 2 days later you actually start to show the result. And basically this is how you would see your defense against certain bacteria or fungus. And this involves a whole bunch of cell types: macrophages, killer T cells, natural killer cells. Antibodies don't play a major role here. But this is delayed sensitivity, or delayed type hypersensitivity, is what you're looking at with a tuberculosis skin test. You inject it, and you have to come back 2 days later to see if there was a reaction. There's the Mantoux test for tuberculosis. Now, when this injection is given, we have to come back within 2 days and see if there is a raised spot of 2 centimeters or more. And if there is, you've been exposed to tuberculosis. Autoimmune diseases basically happen when the immune system doesn't recognize certain body tissues as self, and it tries to kill them or destroy them as if it was a foreign cell. Now, this could occur with tissues that are not exposed to the immune system during fetal development, or it could just be a lack of what we call the T regulatory cells, the ones that are actually taking rogue T killer cells or helper cells out of commission. There are more than 80 recognized autoimmune diseases that we know of, and we can talk about them being organ-specific or non-organ-specific. The organ-specific ones, all of the different things that attack the thyroid, like Hashimoto's and Graves' disease, would be organ-specific. Systemic lupus erythematosus wouldn't be non-organ-specific. It affects almost every organ in your body in one way or another. Now, a lot of people who have autoimmune diseases will be put on drugs that cause immunosuppression. So if your immune system is not working properly, if it's being suppressed, you have an immunosuppressed patient. Now, HIV causes this by disease, but many chemotherapy drugs and a lot of the drugs that we're using to treat these autoimmune diseases are suppressing your immune system and therefore make you more susceptible to infection. There are a handful of inherited immunodeficiency diseases that can be basically due to flawed antibody production or to complement activity or phagocytosis. We do talk about a few of these again in the internal medicine class. And then people can be born lacking the ability to produce antibodies in general. This would be agammaglobulinemia or hypogammaglobulinemia. So in order to diagnose certain infectious diseases, we look for the antigens or the antibodies in clinical specimens. Test results can be found, they're pretty quick. And there are 3 reasons why the person could have antibodies to a pathogen: a present infection, a past infection, or a vaccination. If you don't want to get the varicella vaccine, the chickenpox vaccine, and your reason is you've been exposed to the chickenpox, you can actually get an antibody titer test, which would test to see how much antibody you have floating around in your system due to past infection. A variety of different lab tests have been designed to observe antibody antigen reactions. ELISA tests, which is enzyme-linked immunosorbent assays, are used to detect certain diseases like HIV, like Lyme disease, and they're pretty accurate. The detection of antigens, basically what you do, you get the specimen and an anti-serum, and you introduce the serum to the antigen, and the antibody, and you would get a reaction. If there's no visible antigen-antibody reaction, you have a negative test, you don't have the disease. For detection of antibodies, now you're going to introduce the antigen and see if there's a reaction. Now in agglutination, this is when you give the wrong type of blood to somebody. There's an antigen. The antibody attaches to it, and then you start to get a whole clumping of blood cells together. So in the example on the left here, somebody with type A blood would have the agglutination reaction to the type A serum or antiserum, but not to the type B antiserum. And then vice versa, type AB blood reacts to both, type O blood doesn't react to any. So this is just a list of saying, okay, if you have type A blood, the A antigen is present, the B antigen is absent, and then if you get the positive sign, the Rh antigen is present. And then finally, in these immunodiagnostic procedures, skin testing, we can basically inject the skin, just beneath the skin, the antigens, and this is the TB test. And then if we're looking for immunodeficiency disorders, we're going to actually order B cell levels and also run some tests on cell-mediated immunodeficiencies, seeing how these cells react to different chemicals and complements. I will give you a link to a more complete series of lectures I have done on the immune system for those of you who are interested. Again, all of your quiz questions will come from the slides on this slideshow and the previous one on non-specific immune responses. But if you are interested in learning more, I will give you access to a more detailed presentation I have done on the immune system.